McKay.
Thanks very much. To the people don't mind, I'm going to stay seated while I'm speaking. I'm just in response to John's comments. So, just in response to John's comments, I mean, he talked about the meeting he was doing at 10 year. I'm sure it was as always, John, it was very courteous, but I'm sure it was a heated debate that took place, and there was a few arguments amongst yourself. Comrades, I'm going to speak about just one subject in relation to the private sector against the public, if that's okay. And it's about PFI in the health service. First of all, I want to tell you a story. 18 years ago, at that time, the biggest PFI contract in Europe was signed in Scotland. And Consort, a consortium, including Balfour Beatty amongst others, was given the contract to build Edinburgh Royal Infirmary. Absolute world-class, state-of-the-art hospital. Absolute tremendous coup for the public sector that deal was hailed as. Not one penny was to be paid until the hospital was built, and senior politicians were banding around phrases, people of Scotland have got something for nothing. At the time, if you remember, 18 years ago, 1996, there wasn't a Freedom of Information Act, so the contract was covered by confidentiality, commercial confidentiality. But then as the years went on, information started to get leaked out. The cost estimated at that time, if Edinburgh Infirmary had been built using normal public procurement routes, the cost of building that hospital would have been £190 million. When we finally got information in relation to the contract, what Lothian Health Board had signed up to was a 28-year contract with a payment of £50 million a year for every one of those years until 2028. So a 32-year contract. Now, the arithmetic in that's pretty simple. At the end of that contract in 2028, the public sector will have handed over £1.26 billion to Consort. More than £1 billion profit when that hospital simply handed over your money, handed over to big business and private shareholders. Now, everybody in this room, I'm sure, is going to agree, absolute scandal, and that shows why private finance in the public sector projects doesn't work. You can probably start to guess already that unfortunately that wasn't the end of the story in relation to the contract that Lothian Health Board signed with the consortium, or Consort. In the 2010 NHS board contracts, and it was a footnote on page 63 in extremely small print. Now, I don't actually, I wonder if they actually thought that we weren't going to read it. But it was there. There was a statement that said that in 2028 there would be an option to extend the contract until 2053. Now, again, I'm sure you can imagine what the obvious question you were asked was, well, what contract will there be to extend? In 2028 we'll have paid over 7 times what the actual cost of the hospital was, and the contract will have reached its end. So what is there to renew? Now, I don't know if anybody wants to have a guess what the answer that we're given, but I think probably some ideas are coming into your head already. We were told, of course, that, well, you don't actually understand what the contract was that was signed between Lothian Health Board and Consort. It wasn't a contract to buy Edinburgh Royal Infirmary. It was a contract to lease Edinburgh Royal Infirmary. So in 2028, after we've paid £1.25 billion of public money, giving Consort a £1 billion plus clear profit. In 2028, the whole building reverts back to consort. In 2028, the NHS will not own Edinburgh Royal Infirmary. It's like you've had your mortgage, you've paid it every year, and at the end of the year, the building's arriving and say, well, thanks very much for that, cheerio, now you're getting evicted. That's what the private finance initiative and private financing of the NHS and the public sector does to public funds. Private finance is killing NHS. It doesn't matter whether it's called PFI or other new names like Futures Trust. It's private financing. And all of the political parties at the minute are hanging a do not resuscitate sign on the NHS. 3 specific reasons why PFI or sons of PFI is killing the NHS. The first, just to sense the obvious unneeded debt in the public sector. PFI infrastructure, last valuation, was £122 billion. The actual value of all the buildings was £52 billion. Again, over 130% profit private companies are making in PFI builds. One of the old sayings is, you pay for 2 hospitals and you get 1. That's what we're doing in the NHS just now. At the same time as that, you're seeing absolutely inflated maintenance and contract services. One English trust, £335 to change a light bulb. That's the contract. That's what was signed off. £335 every time you change a light bulb in that NHS. 7 trusts in England now pay more than 5% of their income simply on paying the PFI bill. Second reason is clearly again that repayments actually just divert what the whole purpose of the NHS to provide care to people. And the third reason is that service redesign is now driven by PFI. There's no reason now that it's needs of service, age of community. Just think. Sometimes, if you want to close a hospital, particularly England, I'm an NHS worker, I'm a nurse to trade. Sometimes there can be very good reasons why you want to close a particular hospital. But you'd make that decision, you would think, based on what's the service needs, what's the demographics, what's the age, what skills do you need. That's the reason you would make your decision. But if you've got a publicly funded, as a normal procurement route hospital, and a PFI hospital in your trust area or local authority or health board in Scotland, if all the information points to, well, it would be the public procurement hospital you keep open for all the reasons I've just said, you think that was Ob's decision. But if you're in competition with a PFI hospital, if you shut the PFI hospital, you still have to pay your £50 million every year to the end of the contract to the private company. So the reality is, you wait until you shut the PFI hospital. It doesn't matter what your service needs are, it doesn't matter what your demographics are, it doesn't matter the quality of service, you're always going to keep the PFI hospital open. We can afford to pay for universal health care still, but only if we actually stop using NHS funds to prop up the banks and the equity investors. I just want to finish a quote made recently by Chris Leslie, Labour's Shadow Chief Secretary to the Treasury. He said that a Labour government will not be able to undo the Tory spending cuts and that he's not expecting popularity. Well, Chris, you were certainly right in your second statement, that you're not going to receive popularity. And what also you can't expect, if that's what you're going to do, is that you can't expect to get a Labour government elected in 2015. So he's going to have to change his mind on at least one of those points, if not both of them, both in terms of popularity and about cutting the Tory spending cuts. I mean, I remember one quote at times wasn't about the UK government, it was the Scottish government, that well, they're only doing popular things. You know, sometimes it's not a bad idea as a politician to do popular things. But one way of absolutely getting popularity is by ending the private finance of public services. Thank you very much.
Thank you, Gordon.